everyone, welcome back to my channel. My name is Shirley Becker. I'm a final year medical student here at the University of Cambridge, and I'm a few months out from qualifying to be a doctor here in the UK. Today I'm making a video to discuss all of the thrush medications that are available and how to take them correctly. So thrush is an extremely common vaginal infection. I've made an entire video to discuss vaginal infections and how they happen and the treatment options for them that you can watch if you're interested. I've noticed that with the overwhelming options that are available for thrush medication, it can actually be really confusing for patients to know how to properly take them. So in this video, we're going to break it down together. So firstly, I want to do a really quick overview to remind everyone exactly what thrush is and what the symptoms are. So a normal vagina is a slightly acidic pH and it hosts a colony of bacteria. This is completely normal for every vagina. But when the bacteria are killed off for one reason or another, it allows the yeast cells to overgrow and overpopulate your vaginal area, and this leads to symptoms of thrush and a thrush infection. The symptoms of thrush can be really quite unpleasant. Although some people might experience no symptoms at all, even though they have an overgrowth of yeast in their vagina, some people can experience some really irritating symptoms. And I'll just remind you of what some of those symptoms can be. You might get a symptom called dysuria, and dysuria is pain when urinating. You might get something called superficial dyspareunia, and this is essentially pain that occurs with sexual intercourse. Superficial dyspareunia specifically is the pain that occurs when the penis first enters the vagina, and it's not a deep pain that you kind of feel in your lower tummy. So there can be some real discomfort, some itching and some burning in your vaginal area. You might actually get some indication of irritation on the lips of your vagina, so they might be a bit swollen, they might look really irritated, and they might look red as well. And then lastly, you might get some abnormal discharge, and the discharge for thrush can classically look like cottage cheese. So it's white, it's quite thick, and it can be quite clumpy. Now, if you were to give your underwear or the discharge a whiff, you would actually not really smell any strong odors, and this might be a good indication that what you're experiencing is thrush. Now, treating thrush is thankfully actually quite easy, and it's something that can be done by yourself at home, and the medications are actually available to buy off the shelf or over the counter. Thrush is treated by an antifungal, and I like to call these the azole drugs because all of them end in the word azole. Now, when it comes to the azole antifungal drug, the only downside is that there are multiple options, and with so many options and different ways that they must all be used, it can be quite confusing for people to use them. So I'm just going to talk you through the different options you have in terms of the antifungal or azole drugs, and I'm going to do a quick demonstration to show you how they should be properly used. Firstly, one of the options are an oral tablet, and the oral tablet contains the antifungal drug called Fluconazole. Fluconazole is something that you can get from a doctor or from a pharmacist over the counter. It's a single tablet that has to be taken by mouth and swallowed, and they can help to combat the thrush infection. So I'm going to be showing you a quick demonstration of how this medication looks and how it should be used. Hi guys, so I've come to the clinical center, and this is a place where we can practice our clinical skills, and this is where I'm going to be demonstrating how to properly use the thrush medication. Okay, so let's first discuss the oral tablet. This is the oral tablet. As I mentioned before, it contains the antifungal drug called Fluconazole. It's always a good idea to just look around the box and make sure that the box is within the expiry date. There will be a leaflet with instructions. So this leaflet is really useful because it gives you information about the instructions. It also gives you information about the potential side effects, and also some patients that this might not be suitable for. The patients that this isn't suitable for include pregnant patients and patients who cannot swallow oral tablets. The other thing they have inside is the actual medication. So you get this pouch, and this actually only contains one oral tablet here in the center. And the fact it's an oral tablet tells you that this doesn't actually go anywhere near the vagina. This is a medication that is swallowed. So it's always a good idea to make sure you start off with clean hands. So I'm just going to be using alcohol gel to clean my hands before I actually open the medication. Then what you want to do is essentially just pop this part of the medication open, and that gives you access to the oral tablet that's inside. And then all you do is pop this in your mouth, drink it with a bit of water and swallow it and wait for it to take action and do its job. And you should see your symptoms clear within a few days or up to 2 weeks. When someone has thrush, the first line drug they should try is actually the oral fluconazole tablet. A lot of people tend to run to get the creams because they think, you know, it's in the vaginal area, so it's probably a medication that needs to be rubbed around the vaginal area. The next type of medication that you can use is a vaginal pessary. A vaginal pessary is essentially an internal medication that needs to be inserted into the vagina and then kind of melts away due to your internal body heat. The antifungal drug that's contained within a pessary is called Clotrimazole. So this is a slightly different but also an azole drug. I've got a mannequin here to model a vagina. We actually use this to catheterize, so that's inserting a tube to allow people to empty the bladder. And so in this model, this hole actually represents the urethra, and this underneath is actually what represents the vaginal opening. And so I'm going to be referring to this part as the vagina, so don't get confused that you can see a massive hole here. That represents the urethra. In a real human, the urethra actually isn't this big and obvious, but just bear in mind, I'm going to be pointing at this as the vagina when I refer to the medications. The next treatment we're going to be talking about is the internal pessary, and I think this is the one that can confuse people the most because it's a form of medication that we don't take quite as often as, say, an oral tablet. Everyone knows how to swallow an oral tablet, but not everyone might have come across an internal pessary. So an internal pessary usually comes in a combination box that looks just like this, and it contains an internal pessary as well as an external cream. So once you open the box, it's a good idea to familiarize yourself with what is what. So within the box, the first thing I can point out is the external cream, tube of cream that you can use around the lips of your vagina to soothe the vulval symptoms. But we're coming back to this because I'm also going to explain how to use this. Then you get the actual pessary that comes in this little tab, and the pessary sits inside the central compartment. And then you have an applicator, and this applicator helps to insert the pessary into your vagina because you probably want to insert it quite far up. So again, it's a good idea to start off with clean hands. So I'm just going to use alcohol gel to clean my hands before I open the pessary. Once you pop this open, you will find a pessary inside, and the pessary looks like a tablet. It's really important to know that this is not a tablet to be swallowed. This is not an oral tablet. A pessary is a tablet that's inserted internally inside the vagina. Then you want to grab the applicator and just remove it from its packaging. You'll notice that there's an open end, a closed end with a plunge. So you want to make sure that the plunge is downwards so that there's a space for you to put the pessary inside. You'll notice that the pessary has a square end and a rounded end. What I like to do is to make sure that it's the rounded end that goes into my vagina because it's a bit smoother. And so I put the square end of the pessary into the applicator. So I just force the square end into the applicator. So this is what it should look like. This hole here actually represents the urethra in this model, and then this hole here represents the vagina. What you would want to do is essentially look for the hole of your vagina, and this is something if you squat down that you can just feel because you can actually insert a finger into your vagina. Don't worry too much about getting it in the wrong hole, this urethra, because you can't actually put your finger into your urethra. So you should be able to feel for the entrance of your vagina with a finger. And then you just want to insert this into your vagina. And in real life, this would actually go quite far back in. So if you push this into your vagina, and once you feel that you are near the back of your vagina, you just want to push on the plunge. And what that does, as you can see, is push the tablet out. And this tablet would actually be sitting at the back of your vagina once that's done. It's really important that you do not take this by mouth, but this is inserted into the vagina. You should aim to put in a pessary right before you go to bed because then you're laying flat and it can just melt and sort of work to treat your thrush infection overnight. And you know, you're not walking around and it's dripping down your leg and it's starting to melt and it's starting to bother you. Even though I just said that the oral fluconazole tablet is the first line medication that should be used, if for some reason you cannot take this tablet, which is called a contraindication, then the Clotrimazole Pessary is actually the next best medication that you can use. Then the next option that's available to you is the cream. So the cream is something that's used externally on the lips of your vagina. So they can be put on the outer lips, the inner lips, and then the inside of the inner lips of the vagina. This contains an antifungal medication called imidazole. So again, it's another azole drug, but a slightly different one. And this is really useful if you're having some symptoms on the lips of your vagina. So if you're finding the lips of your vagina to look irritated, look swollen, look red, and to just be so unbearably itchy, then it would be a good idea to use the cream as an addition to a pessary or in addition to the oral tablet. But I wouldn't really use it as a standalone drug. I would really use it as an addition to help with the symptoms of the lips of your vagina. So the external cream can be bought by itself, or sometimes it actually comes in a combination package with the pessary or the gel or the internal tablet or the internal cream that you can buy. They all work in the same way, but this external cream will say on the package that it's the external cream. And external means this does not go inside of your vagina. So this is not designed to be inserted on the inside of your vagina. It's designed to be put on the vulva of your vagina, so the lips that surround the entrance of the vagina. When you unscrew the lid of the cream, you'll notice that this is actually unopened, and that's how you know it's new. The way that you get to the actual cream, there's a part of the lid that closes the cream, and then there's another part of the lid that can act as a puncture. So what you want to do is use that part of the lid, puncture open, so push down, and that will open up the cream, and now you can see that the cream will actually start to come out. This demonstrates the vaginal area. Here you can see the lips of the vagina that surround the entrance of the vagina. And what you want to do with the cream is you want to get a bit of the cream. You can actually be quite generous with this cream and take quite a substantial amount. And if you have symptoms around the area of the vagina, what you can do is just apply the cream like this on the inside of the lips, on the outside of the lips, and anywhere where you can feel that really irritating and itchy feeling of your vagina. And this just helps to soothe those symptoms as well as working on the thrush infection. And then once you've finished using the creams, just remember to wash your hands properly so that you don't have residual cream on your hands. And hopefully that helps to soothe some of the really unpleasant symptoms that can come with thrush infections. Okay, so I hope this video was really useful for familiarizing yourself with the different medication options, which ones to use first line, second line, and so on, and also how exactly to use them to make sure that you're using the right one in the right place. If you found this video really useful, make sure to like the video so that it gets recommended by YouTube to other people just like yourself. Make sure to comment down below so that I can read the comments and know that, you know, this type of content is useful for you. Share the video out to people you think it might be useful for, and subscribe to the channel if you haven't already. Make sure to click the post notification bells so that you actually get notified when I post, because a very small percentage of my subscribers actually get told when I make a new video. And apart from that, I really hope to see you in the next video, and I hope that I keep making content just like this. Bye!